Our first viewer problem today comes from Sheila. Sheila writes, I'm concerned about my nephew. He is 6 years old and really overweight. My sister and her husband aren't exactly slim and trim either, but he is really going down an unhealthy path. I know it may not be my place to say something, but someone has to speak up for him. He's learning horrible, unhealthy habits. How can I approach my sister about this? I can't keep quiet. Honestly, I consider this child abuse, writes Sheila. So this is a really touching issue, touchy issue, but what I want to say most of all is if this child is classified as overweight and obese by a CDC growth chart as shown by their pediatrician, then yes, Sheila, you are right in that you should take steps to step in. But before you do so, don't just say your child is fat. Bring solutions and bring the facts. And that's what I want you to do, because being overweight as a child can increase your risk for heart disease, diabetes, as well as social ostracization, which is difficult.
And a lot of times it's an entire family that's unhealthy because it does. It starts with the parents, and if they don't know how to be healthy, their kids aren't going to know as well. So I feel like if it's your sister, it's something that you should be able to have that conversation.
Because it's not a conversation about, oh, your kid is fat. It's a health concern that can resonate with the whole family. So
you care about them.
Exactly.
You love them.
You're wanting to help. So
yeah.
Sheila, invite them to your house and have a healthy dinner, or encourage more maybe nighttime walks, plan some play dates that are fun and active, and I think that's the way to go.
Yeah, it's some sensitivity too, though, right?
Yeah,
you don't want
definitely.
to go in guns blazing and
write it down,
That's
like we
the
talked
key.
about with
Yeah,
forgiveness.
exactly.
Write down what you want to
how
say.
you deliver it, because that can come off as, oh, well, I'm super healthy and you guys are all fat, so here's what you should be doing. And you don't want it to come off that way, so you got to be careful.
You're really trying to help and change a kid's life.
Here's what you guys had to say. Christy says, she's your sister, so I say tell her exactly what you think in a direct manner, kind of like I said. Susan says, most people really don't know how to eat healthy. Why don't you suggest something like Weight Watchers, where mom and dad would learn healthy eating habits, thus they would feed the child better foods, or you could suggest seeing a dietitian. Melissa says, it makes me angry that the pediatricians do not intervene in cases like these. And like Carissa mentioned, they are supposed to give the guidelines to pediatricians.
It's a CDC growth chart. They should be able to plot their height for weight for age, and they would know from that.